Welcome to This Explainer. Today, we're acting as medical detectives to unpack a massive biological mystery that affects millions of people around the globe. We're looking at Irritable Bowel Syndrome, or IBS. It's a condition that can absolutely disrupt a person's life, yet from a strictly medical standpoint, the clinical picture often looks perfectly normal. It really begs the question, how can something so incredibly painful leave so few physical traces behind?
Okay, let's dive right into this by asking a fundamental question about an incredibly common yet widely misunderstood digestive condition. Why does the gut suddenly turn against itself? What transforms a perfectly normal everyday process, like just digesting a meal, into an event that causes intense pain, bloating, and distress?
To uncover the truth, our agenda today will cover 5 key areas. First, defining irritable bowel syndrome. Second, contrasting IBS versus IBD. Third, unpacking the underlying biological mechanisms. Fourth, identifying triggers and risk factors. And finally, treating and managing symptoms.
Section 1. Defining Irritable Bowel Syndrome and establishing the baseline.
Irritable bowel syndrome describes a highly disruptive pattern. We are basically looking at recurrent bouts of abdominal pain paired with totally abnormal bowel motility. This abnormal movement causes issues like constipation, diarrhea, or, wildly enough, a frustrating mixture of the two. One of the most unique clues of this condition is that the abdominal pain often improves right after a bowel movement. It's this vicious, ongoing cycle of buildup and relief.
Section 2. IBS versus IBD, clarifying the suspects.
The absolutely crucial distinction here is physical damage. Inflammatory bowel disease, or IBD, involves true tissue damage. We're talking visible inflammation and painful ulcers. Irritable bowel syndrome, however, totally lacks this physical damage. It's strictly classified as a functional disorder. Think of it like a computer. The hardware of the gut looks totally fine, but the software running it, well, it's glitching.
Section 3. The underlying biological mechanisms. Let's follow the physiological clues.
The first major clue we have is something called visceral hypersensitivity. Think of it kind of like having an oversensitive home alarm system. Normally, when you eat a meal, your intestines stretch. It's standard, right? But for a lot of people with IBS, the sensory nerve endings in the intestinal wall have an abnormally strong response to this regular stretching. Normal stimuli trigger a massive painful alert. This visceral hypersensitivity explains exactly why patients experience such severe, recurrent abdominal pain just from eating a normal meal.
And the abnormal bowel motility? That follows a very specific, fascinating chain reaction. It starts with food, specifically short-chain carbohydrates like lactose and fructose. In an IBS gut, these unabsorbed carbs act as solutes, literally pulling water right across the gastrointestinal wall. All that excess water can cause the smooth muscles lining the intestines to spasm, which leads to diarrhea. But wait, it actually gets worse. The bacteria living in your gut, your bacterial flora, metabolize those leftover carbs. This produces gas, triggering even more bloating, spasms, and pain. It's basically a perfect storm in the gut.
Section 4. Triggers and risk factors, profiling the culprits.
Demographically, there is a super fascinating geographic divide. In North America, irritable bowel syndrome is most common among middle-aged women. But globally, it affects both sexes equally. It really makes you wonder about the complex intersection of environment, diet, and biology, doesn't it?
Beyond demographics, we've identified primary suspects that trigger the development of IBS in individuals. One major risk factor is surviving a severe stomach bug. Specifically, we're talking about a bout of acute gastroenteritis from nasty viruses like norovirus or rotavirus. Your gut fights off the virus, sure, but the system is left highly sensitive and glitchy. The other massive trigger? High levels of stress. The gut and the mind are deeply, deeply intertwined, and significant psychological stress is a proven catalyst for developing this functional disorder.
Section 5. Treating and managing symptoms. The action plan.
Removing the exact short-chain carbohydrates that ignite that water-drawing cascade we talked about earlier is a highly effective first line of defense. This means making targeted diet modifications. Patients are often advised to avoid specific trigger foods like apples, beans, and cauliflower. It sounds simple, but managing exactly what enters the gut can stop the biological cascade before it even has a chance to begin.
Now, when diet just isn't quite enough, clinical interventions are sharply targeted to the specific symptoms.
If a patient is dealing with constipation, doctors will deploy soluble fiber, stool softeners, or osmotic laxatives to help clear the blockage. On the flip side, if the patient is suffering from those intense gastrointestinal spasms and pain, they might prescribe serotonin antagonists, antimuscarinic medications, or other antidiarrheals. These medications essentially act to quiet down those overactive gut alarms and stop the painful muscle spasms in their tracks.
Furthermore, you absolutely cannot ignore the psychological component. Because the gut and the brain are so intimately connected, actively treating the mind is a validated critical piece of the overall treatment puzzle. Helping a patient manage stress and controlling feelings of anxiety and depression can significantly alleviate the physical symptoms of IBS. It's a brilliant reminder of just how holistically our bodies operate.
So to briefly recap our explainer today, irritable bowel syndrome is a highly real yet functional disorder. It causes recurrent abdominal pain with constipation or diarrhea. And importantly, it lacks the physical damage seen in IBD. It seems to be driven by an overly sensitive gut and specific carbohydrate triggers that draw water into the intestines. But the good news is, by using targeted diets, specific medications, and active stress management, we can absolutely control the symptoms.
As researchers continue to follow these biological clues, we really have to wonder what fascinating mysteries of the human digestive system are waiting to be solved next. I mean, if a simple short-chain carbohydrate can cause this much chaos, what else are we missing about the microscopic world inside us? Thank you so much for joining me on this investigation, and keep questioning everything.